I'm seeing people checking in. I appreciate the check in. Make sure you like. Make sure you hit the double tap. If you're not already following, we are on TikTok Live. If you're not already following, make sure you hit that follow button. Today we gotta talk. We gotta talk, y'all. I did a video on this on the profile, but I said, you know what? It's Thursdays. We go live on Thursdays anyways. We might as well talk about it. One of the top, I'll say for me, it was like top 5. I'm 40 years old, just to give you an idea, just to give you a window. One of the actresses we looked at as like Rushmore of type actresses, right, was Topanga in Boy Meets World. Fire show. Amazing show. And of course, so I got saddened when I saw this news come across my timeline. Boy Meets World star Danielle Fishel revealed she was diagnosed with breast cancer, y'all. Stage 0 breast cancer, but breast cancer all the same. It hurt my heart. And like I said, typically I know October is typically when we say, you know what, let's start wearing pink and let's start telling everyone, to get diagnosed and get screened and everything. But Topanga has breast cancer. So we're gonna start the discussion early. We are starting the discussion early because Topanga has breast cancer. Now, she revealed this information on, I didn't even know they have a podcast. Like, she has a podcast with one of the other Boy Meets World stars, and she let her podcast host, as well as everyone who was in earshot of the podcast, know that she has breast cancer. Thankfully, she caught it so early. And the reason why she caught it, right, we're going to talk about it. The reason why she caught it is because she got that routine text message to say, hey, you're coming up on your annual mammogram. You're coming up on your annual exam to screen for breast cancer. That's what the mammogram is, if anyone is unsure what a mammogram is. And she said, okay, yep, let me go do what I need to do. And she went and she got the screening. And they caught the breast cancer at such an early stage. She called it stage 0. I'd have to look at it. Like, she called it stage 0, but again, we're not here to correct, right? I can tell you, and what I always tell my patients, and I tell my families, the second your doctor says the C word, cancer, everything else after that don't really mean a hill of beans. It do not mean a hill of beans. If I say you have cancer, whatever I say afterwards, it's almost like a fog, which makes sense, right? Because when we hear the word cancer, we only think of the end result, dire, most, bad result that we can think of. So of course it makes sense that if I hear like, hey, you got cancer, regardless of whatever the cancer is, you got cancer, everything I said after that is going to have to be repeated at a later time once you kind of get your bearings together. So she went in for her routine screening. She is 43 years old. And depending on the age, we typically will say starting at the age of 40 is when we start screening for breast cancer. So she was 43 years old. She was already getting her routine screenings done, which means I'm assuming she got at least 2 mammograms prior to it, which were negative. And then this one pops up positive. So first of all, shout out to medical technology. Saves another life. Shout out to medical technology. I think a lot of times, especially with this day and age where we got handheld devices that can, send faxes and edit pictures, edit videos, video conference from, across the country. A lot of times people don't think about the medical technological advances that are in medicine. So shout out to the mammogram. Shout out to the creator of the mammogram, the technology behind the mammogram that helped save another life. Really easy, right? We love that. Shout out to the mammogram. So she, age of 43, diagnosed with this what she called it? Ductal carcinoma in situ. Ductal carcinoma in situ. American Cancer Society says it has a great prognosis if caught early. And I have to stress this, if caught early. One of the things I always talk about, especially with my patients, is that most diseases, if we can treat appropriately and treat quickly, most diseases will have a good prognosis. What typically happens is if we catch a disease and we don't catch it in time. Because the further out a disease is, the further out the diagnosis of that disease is, we have less treatment options. Which makes sense, right? If I catch something and she's a stage 0, if I catch it in stage 0, I have a lot more options in my tool belt to treat. Hey, Millie, how you doing? I have a lot better options to treat. But if I catch it at stage 2, stage 3, stage 4, guess what? The tools in my tool belt start to decrease. So we have to be, again, very mindful that when we're talking about any disease course, is the understanding that catching it early will always be better. Regardless of what blank disease is, catching it early will always be better. So again, Danielle, who I know her more affectionately as Topanga, has breast cancer. She has great follow-up according to her. She caught it on a routine screening, so it wasn't something that she forgot about, like, hey, I haven't got a mammogram in a few years, and they just happened to catch it. No, it was a routine screening. She got the text message and said, hey, come get your mammogram. She got the mammogram. She got the text message and said, okay, let me go get the mammogram. And then she got it done. And thankfully, and I do say thankfully, we were able to diagnose her earlier because we know the treatment options we have are going to be much more beneficial, typically much less harmful for her, kind of moving forward, right? And you may be saying, well, Dr. Barry, yeah, may God be with her. Yes, well, indeed. When we talk about the rubric, right? Like I said, y'all are going to get a lot of this in October, because in October, when it's cool to wear pink, a lot of people are going to be talking about, hey, breast cancer this, breast cancer that. But Topanga has breast cancer, so we're going to talk about today, right? So let's start from the beginning, right? If I am thinking like, hey, you know what? When should I be thinking about getting breast cancer screening? I always ask a few questions. One, how old are you? Because in an ideal world, and I do always have to stress this, in an ideal world, when we talk about breast cancer screening, we say starting at the age of 40, in an ideal world. Now, what makes a person ideal? First and foremost, family history. Family history is probably one of the biggest aspects of it. Why? Because we know breast cancer has significant genetic component to it. So we know that if the family history is favorable, I can wait till 40 years old. But let's say family history, let's say in her family, the fact that she was diagnosed at the age of 43, already lets me know I have to wind down the clock for any children of hers after the fact. Right? And someone in the chat says, I have BRCA2 gene. I have been under watch since the age of 21. Yes, right. So we have, and this kind of goes back to the genetic aspect of it. There are genes that will make you more susceptible to having, ovarian, breast, lung. There are genes aspects of it that will make you more susceptible to having these types of cancers. So I got to get the family history. I have to know, do you have a family history of cancer, especially cancer at a younger age? We talk a lot about Chadwick Boseman, who passed away, I think it was 34, 35, right? Which already tells me that there was a significant family history of it somewhere, to the fact that he had an advanced cancer at an age where we are not even typically checking for colon cancer. Usually colonoscopies, we start thinking about 44 years, 45, depending on, age, race, and everything else. But if 34, he was already diagnosed with such a significant cancer that it killed him before he got to the age of 40, that already screamed there was some genetic component in the family history that says, oh, I got to do something. So we talk about age, we talk about family history being another one. There's some, issues as far as whether you're a smoker, whether you're on hormone replacement therapy, because a lot of these cancers will be hormone induced, meaning that because of, whether it's birth control, lack of birth control, estrogen, supplemental things can actually feed into the cancer. I have to be wary of that as well. I know if I'm a smoker, y'all already know where I stand on this channel with smokers. Cigarette smokers are like the devil. You should never, no one should be doing cigarettes. We should just not be doing it. So it is one of these things where you have some genetic components. We have some things that you can change. Obviously, race is a big one. And race is a big one because it encompasses race. It encompasses the genetic aspect of it. It encompasses the fact that typically screening is typically either not done or done too later, right? So there's a lot of psychosocial aspects associated with why race is such a big thing, but obviously the genetic factor being a huge aspect of it. So race is a big one. So we already walk in with that package of, hey, these are my risk factors before I even go to see the doctor. So before I go to see the doctor, now, second step, right? Is there any signs or symptoms? AKA, especially I know my women are typically doing typically doing daily, but like actually, when I talk about breast exams, especially the self-breast exams, obviously, and again, I'm not gonna speak for women, right? But like, obviously there's exams where you're like actually looking to see if something's going on. I'm not talking about when you're just taking a shower and everything, but when you're actually looking to see something's going on. I know typically my OB guys, my primary cares will just say, hey, once a day, just to make sure what's going on here. Right. But of course, obviously, when, if a healthcare provider does a physical exam, there may be issues that may be of concerning, especially when we talk about pain, lumps or anything else. I always give this story. When I was doing outpatient medicine, primary care medicine, one of my patients, again, I think it was like my first or second time seeing her. I'm doing my thing. And then at the end, I say, oh, it's about that time. You haven't had a mammogram yet. I know you haven't seen a doctor in a while. Is there anything you want to let me know? And then she showed me like her breasts. And when I tell you, she had almost like a golf ball size mass like under her breast. And I of course, I'm a physician, so I got to play it cool. I'm a physician, so I got to play it cool. In my mind, I'm screaming. I'm like, what is going on here? But my physician brain, right, the outer physician is like, how long did you have that? Because I was shocked. It's probably the worst form of breast cancer I've ever seen. Because like I said, it was a golf ball size mass that was almost like protruding out, that she was just kind of putting like a cover on it. And it was something that she would have left that office without even saying something until I said, hey, it's about that time for breast cancer screening. Like, what's going on with that? Like, I don't see any documentation of it. So never be surprised on what you'll find, especially in a hospital setting. Just never be surprised for that. So obviously there's some physical exam findings, right? And then that's when we start talking about imaging aspect of it, right? The technology associated with medicine. Right? I'm seeing some comments here. Let me make sure I get to my comments. I don't want to miss any questions. Okay, good. Okay, good. No. Okay, good. No question. So it becomes this interesting aspect, especially when we talk about breast cancer, especially when we talk about, just this awareness aspect of it, is that making sure you are getting the screenings when you're supposed to get the screenings. Typically, your doctors will send you out to get a mammogram. Mammograms happen typically once a year. And usually once a year for about a decade or so. And then after a decade, we see like, okay, yep, you've had about 10 years of straight negative mammograms. Okay, now you can do it every other year. And then now we can kind of stretch it. But again, obviously, that's when your doctor has a great track record of saying like, okay, I think you're okay. Now, there are some imaging modalities. Sometimes your doctor will do breast ultrasounds. And that's typically when we see or we're concerned about lumps or masses. We may want to get an ultrasound just to say, hey, what am I dealing with here? Especially for my younger patients. My younger patients can have lumps and, have some breast tenderness, but that doesn't mean cancer, right? Because one, I don't want y'all to leave this live, start doing your self-exams and say, hold on, this is a little tender right here. I might have cancer, and then run and go. Like, I don't want y'all to do that. I want y'all to be informed that that's a possibility, but I can tell you typically when you're younger, it is more likely that if you have any breast tenderness, especially if it's associated around your menstruation, it's usually hormone related, usually fibroadenomas. Again, usually not cancer. But again, I don't want you running to your doctor saying, hey, I watched this live. I think I got cancer. I don't want y'all to do that. Don't WebMD me. Y'all already know how y'all do. Y'all already know again. And mind you, y'all know, especially those who follow me, make sure you follow me. Hit the hearts to follow me. Those who follow me know I love my patients who WebMD, who Google, use Perplexity, who tries to do some type of research on all of their medical issues. Like I love those patients, right? So you never have to worry about like feeling like, oh, I don't want to show him my stuff because he's gonna think I'm one of these Google patients. No, I like the Google patients. There's nothing wrong with the Google patients, right? Let me put that caveat. There's nothing wrong with the Google patients. Only issue that typically happens with our patients who Google a lot is that they'll Google something, right? And then they'll take it to the healthcare provider like, hey, I just Googled this. Word is bond. This is cold hard facts. And you need to follow what I just Googled. They don't even give the doctor a little chance to interject, throw a little seasoning on there. They don't typically give that doctor that chance to do so. That's all. If you follow me, I ask you not to do that. I do ask you, hey, if you got high blood pressure, high cholesterol, if you're concerned about breast cancer screenings and everything, go ahead and do your Googling and say, hey, doc, like I was doing my online research. I was concerned. I'm 40 years old. I'm 41 years old. I've never had a mammogram before. I did some research. I watched this live. And he said that it's probably the time. What do you think? What do you think? And then you let the doctor say, okay, well, this is what I think, right? Because you have to give that doctor, again, not all of us are the same, as you may know. You have to give the doctor a little chance to say like, okay, let me make sure that they vetted this information appropriately so I can give them the right information, send them down the right path, right? So again, shout out to my WebMD, my Google folks. Don't feel that you can't use those sources. Obviously, use good sources and, be able to be corrected if the source you use happen to not be good, right? So let's go back to Topanga. So we've talked about our risk factors, right? The age, gender, race, family history, social issues such as maybe cigarette use, hormone-related use, or my birth controls and stuff like that. Obviously, the signs are typically, a lot of times, especially with breast cancer, there are none. Unfortunately, right? Unfortunately, sometimes you have no signs that like, hey, there's no signs. It's just that when I go to do my screening, boom, there it goes. Now, when you do have signs, you typically, again, you can have some pains, you have some discomfort, you can have some lumps, right? You can have some things that may show up, but a lot of times, not surprisingly, you have no signs and symptoms and the breast cancer is there, growing, right? Growing intracellularly, growing within the tissue. So that becomes a concern. So when you get these signs and, there's not really, the blood tests kind of go back to, one of my guests on here that talked about how she has the BRCA gene. And because she has the BRCA gene, she has to be screened more frequently and screened much earlier, right? So blood tests, typically I'm going to get into blood tests when I'm thinking about, all right, risk stratification. Like, are you a medium risk, high risk, low risk patient? Is there some family history that I got to be concerned about? Did mom have breast cancer? Did father have lung cancer? Did grandpa have, some type of stomach cancer? Is there like some cancer history that I got to be concerned that, hey, you may have some cancer producing gene that we have to be very mindful of and keep a watch on you, right? That's usually how that kind of goes, especially from a blood related standpoint. But usually the gold standard is going to be your imaging. Usually the gold standard will be your imaging. Again, mammogram, is the top dog. They are doing a lot of new studies as far as different types of mammogram, different type of CAT scans just to see if the tissue can be seen a little bit better. But mammogram is the gold standard. Ultrasound, again, is more of a follow-up, especially if we have a mass or something that we want to necessarily pinpoint. Because then we go into the treatments. The treatments can vary. Treatments can be, hey, you know what? We caught it early enough. There's a small little area. I'm going to go after that small area specifically, whether it be with radiation, whether it be if I have to do a systemic approach, whether it be some chemotherapy, whether I have to do kind of localization, AKA like a surgery, like a lumpectomy. Sometimes, and you guys know this, some people get mastectomies, right? Sometimes they get the whole breast tissue removed just because, like, hey, you know what? The concern that it could spread too high. Let's just get the whole breast out of there. Right. So there's a lot of different options that can kind of vary, whether it be radiation, whether it be some surgery, whether it be some medication from a chemotherapy perspective, a lot of different variations there. But again, when we talked and kind of review, it all goes back to when do I catch it? When do I catch it? Thankfully, Topanga caught this thing early. So her treatment options are pretty open, right? She may not necessarily need to go through a significant, full-blown mastectomy. She may not need to do all of that because they caught it early enough. But let's say she got the text message, and let's say she would have ignored the text message. And then, I'm going to put it off for a year. And depending on the type of cancer that she has, it can go from a cancer that's kind of just within the cells, in situ, kind of bubbling, versus like an invasive cancer that now it's affecting tissue and everything else. That can occur. So that's why, again, it's so important to keep a mindful watch on yourself, on your family members, making sure that they're keeping up to date. My mom hates me because every time if I don't even remember, because I'm usually up to date on when my mom gets her colon cancer and breast cancer screenings. I'm like, hey, what month you got your mammogram again? Because I just if for some reason I forget, I'm giving her a phone call just to make sure, right? Just to make sure, like, hey, by the way, right? Because I can't be the physician's son and not make sure their parents are doing what they need to do, right? I would look crazy. That's just me. I would definitely look crazy. Let me make sure. Yep. We're not missing anybody. My name's everybody. Appreciate you. Let's see here. Oh, I like it. And Pamela did this is a great question, right? Well, just a great statement. Must be nice to have access to healthcare to find it at stage 0. Exactly. Right. And reason why I like this point is because a lot of people do not take advantage of the advantages they have. There are a significant amount of people who do not have the access to get a text message to say, hey, your routine mammogram is due. Right. There are a lot of people who don't have access to, the OB-GYN or the primary care or whoever happened to prescribe it. Like, there's a lot of people who do not have that access to it. And then even if they had access to it, thankfully, shout out to the Affordable Care Act. These tests may cost some money as well, too. So financially, you may be restricted in even getting these tests here. And that is the reality for a lot of people, especially when I talk to my Black patients. A lot of times my Black patients will run into this issue where, like, doc, I ain't have insurance for X amount of years. And, that copay was expensive and, reason after reason. And I always say, hey, you know what? I understand that there are reasons there that can cause you to have a delay, a blockage. I 100% understand that. But at the end of the day, we're going to have to still do something, right? And that's why I'm always big on taking advantage of any health fairs that may be local, especially, and I'll talk about if you're uninsured, right? Health fairs, local clinics, because typically they do the routine screenings, whether it be for blood pressure, cholesterol, diabetes, and they always will have a division to try to get the mammogram done. They will always have a little all right, what about your mammogram, breast cancer? Like, they will always have something there to get it done. Because again, it is one of the, unfortunately, especially in healthcare, one of the inequities that we typically face. That there are, like, I'm in South Florida, right? You throw a rock, right? You're going to hit some doctor's office, right? Like, that's how many doctors are over here. There are a lot of cities and towns. In fact, I interviewed, it hasn't come out yet, but it'll come out. It'll come out in a couple weeks. Dr. Sharon Smith, right, who is an OB-GYN, who does locums work, and she will go to towns where she's the only OB for hours away. Think about where you live at right now, and think about if you had to drive a couple hours to get to an OB-GYN for like your routine pap smear, right? Just to give you an idea. And this is this is not a third world country. This is here in the United States of America. So understanding that there are significant inequities in healthcare and healthcare distribution and healthcare access is extremely important, especially when we see news articles like these, because we know that they're very fortunate, right? Which is why I think a lot of times people get taken aback when they see celebrities who succumb to medical diseases early that like they shouldn't have came to, because they're like, hold on, like you had all the access and you still. So it's not as if having access will make these people get yearly mammograms, but it sure does make it a lot easier. So I absolutely love that statement, because it's so true. It is so true that we have a significant roadblock here in this country of being able to get access to healthcare for everyone. So that's why I'm big on like, all right, what are some ways I can try to, solve it, get around it, work through it? I think the biggest ones are health fairs, right? Because you can always quickly get your blood pressure done. Typically they'll do your diabetes or cholesterol screenings. Those are usually pretty easy. And they will always try to find a way to get a screening. If you have a local clinic, again, even if it's an hour or two, thinking about the ways I can try to get to this local clinic, because we have to, right? We're not going to bring our cancer, rates and deaths down until we get the ability to get access to everyone, right? And which is why locums is so important, because again, you can't have these doctors who go to these towns where there's like literally, again, like she goes to a place 2 hours away is the other nearest OB, right? Which is wild for me to think, because I'm in South Florida. So I can't even process having to go like drive 2 hours to get to the nearest internist. Like that's not even something that I can even process. But unfortunately that is there. So I love that statement, because it is extremely, extremely true. Yep. Always advocate for yourself. Also be open to professional opinions. Yes. So this is Kay. She might be referencing when I talked about my WebMD, my Google patients. We love them. But it's so important. It's so important, especially again, even when we're talking about cancer screening, it's so important to kind of understand when you may be due for some type of cancer screenings, because maybe your doctor, doesn't remember that you hadn't had one done yet, or it forgets, or they're so busy. That's a possibility as well too. But imagine you walk into the office and say, hey doc, it's about time for my colon cancer screening. It's about time for my mammogram. It's about time for these tests. Like, are we ordering these things? Like that doctor's not gonna be like, oh, they don't Google this thing, I'm not gonna listen to them. Doctor's gonna be like, oh, you know what? Yeah, you're right. Let me stop playing games. But you got to be able to be in a position to advocate for yourself, so you can kind of have that great conversation with your doc. So very, very good question here. Very good question. I appreciate. Thank you, Angie. I appreciate you. Yeah, no, this is typically what we do, at least on the live tip. Now I do like, because she was asking me, she's telling me thank you for the share. Typically on the live, we will have a topic of conversation that comes across the social media timeline, either mine or someone that sends to me. Today, like I just had to talk about Topanga, because like it kind of hurt me, right? Like I said, she was top 5, probably top 3 for me growing up. Topanga, Hillary and Fresh Prince. I'd have to think maybe Lisa in Saved by the Bell, right? Just so I can age myself out here, right? Some, if I got young folks on the timeline, y'all probably have no clue whose names I mentioned, but that's okay. But Topanga was up there, so it definitely hit me, and I said, oh yeah, we got to talk about breast cancer, right? So, because anytime I get a chance to talk about any disease, breast cancer, colon cancer, prostate cancer, I'm gonna do it. But it typically hits a little bit more, especially for my viewers. It typically is a little bit more if they can recognize the person, right? If they can like, hold on, I remember her. Like, oh, she has breast cancer. And then all of a sudden, it kind of gets the conversation going, right? So let me see. I don't see. Do I have any more questions? All right. No more. I just love a comment on you about the post. Oh, yeah. So Camille says I left a comment. Diagnosed at 18. Yeah. Right. So Camille says she was diagnosed at 18 with DCIS, right? Ductal carcinoma in situ, right? So it is one of these, especially when we talk about breast cancer. Again, the earlier, first of all, I hope you're doing well, right? I hope you are, because I'm not sure how old you are right now, but I hope you did well. Hope the treatment course was, as good as that could be for you. Because it is, like I said, it is a scary thought. Like imagine y'all being 18 years old and getting that type of diagnosis, and you're trying to postulate, all right, what is my future going to look like? Right? She's 34 years old, had a double mastectomy, no chemo, no radiation. Yeah. So, thank the Lord. Thank the Lord for that. I'm glad they caught that early, especially at 16 years. So 16 years. So if we catch these things early, the treatment options we have, right, the treatment options we have are definitely significant for you, right? Yeah, so we catch these early, treatment options are definitely significant. So again, I'm thankful that you're here because it is, again, it is just a testament to obviously, getting tested, having good treatment options, and more importantly, having that good follow-up to make sure, right, that we get you to the 35th birthday and 40th and 50th and so on. So, I'm glad you were diagnosed early. Someone says, good question. A family history of lung cancer. Should I get genetic testing? Yeah, so you know what happened? Lung cancer is interesting, right? Because lung cancer, yes, there is a genetic component, a part of it, but a lot of times there is issues like socially, right? So, and by the socially, the big cigarette, right? So one, I would want to know, all right, was there any significant cigarette smoking history associated with the lung cancer? Or was this a person who had like no contact, no secondhand smoke, no anything, and then they developed a lung cancer? Because if it's the latter, then I'm concerned, like, okay, there must be some genetic issues going on because people typically just pop up. Not to say you can't, but people are typically going to pop up with a lung cancer out of nowhere. So if they do, you do get concerned for, some type of genetic component associated with the lung cancer. Now, but if there's that exogenous aspect of it, like usually cigarette smoking, depending on occupation, shipyard, asbestos, and things like that, then you become concerned that it was the exogenous thing that caused the lung cancer versus a genetic component associated with it, right? So that would be my question. Typically, what tends to happen, especially for lung cancer, from a screening perspective, your pulmonologist will usually recommend, if you have any smoking history, typically they'll recommend you getting at least one CAT scan. So they don't even go with a genetic aspect of it. They say, like, let's just get a CAT scan of the chest just to make sure, we kind of go from there. Because lung cancer is typically especially primary lung cancer, is typically a slower developing cancer. And the age is typically at the older stated age, as long as there's no significant component of it. Breast cancer, ovarian cancer, cervical cancer, those are the ones are usually significantly hormone related, which is why family history and genetics play such a big factor, which is why they typically would do like the BRCA testing and whatnot for those types of cancers, because they know how significant, testicular cancer as well, because they know how significant the hormones play a factor in it. But very, very good question. So of course they can ask. Yeah, so you definitely can ask if you have a family history of it. You can, especially we're talking about lung cancer. You definitely can ask for like, hey, like what age should I be getting, screening for lung cancer? And typically it's 50 years old. And the reason why it's 50 is because the reason why I say it's 50 is because that's when the insurance companies will typically cover your CAT scan, right? Unfortunately, in medicine, if this is your first time catching my live, we always go into the realness aspect of medicine business. A lot of times when we say, screening exam starts at 40 or screening blood test starts at 35, what we're saying is that, hey, this is typically the time where insurance companies will cover it. Not to say that you can't have it earlier. Not to say that you cannot have any of these tests earlier, but typically when we're saying it is because we know that's when if I submit a bill to say, hey, you know what, I'm doing this mammogram for this patient, she's 40 years old, they're not going to say, hey, why is a 40-year-old getting a mammogram? They're not going to do that. If a 20-year-old, and I submit an order for a mammogram, they'll be like, whoa, hold on now, Barry. What are you doing? What, like, nah, like 20 years old, crazy. And that's really the thought process of it. One, because they feel that the ratio of false positives is going to be so high if you start screening earlier that they rather not go through that process. So they rather not go through the process of doing screening tests earlier because the ratio of having false positives are so much higher from it. Oh, thank you, Michelle. I appreciate you. So that's usually the big concern with the screening. But usually a lot of times, unfortunately, it is insurance based, which I hate to say it, but unfortunately it's the reality, right? So when you have your doctor say, hey, we got to wait till 40, it's because they know the insurance company will pay at 40. When you got to wait till 50, they know insurance companies will pay. because when I was a medical student, which is like, oh my God, over a decade. Wow, that's crazy to think. We were having arguments, and by we, I mean like the medical societies were having arguments on breast cancer screening, because one society, I'm not going to call them by name, one society wanted us to wait till 50 years old to start screening for breast cancer. And the other societies, there's a couple of them, were like, no, 40, right? So it was actually very contentious, and contentious in academic terms mean like, we'll do a paper over here, this people will do a paper over here, we'll go to a conference, we'll do a little talk. But it was very contentious because one organization felt that, hey, we should wait till 50 years old to start screening for breast cancer. And the other organizations were like, no. I'm seeing way too many women between 40, 45 getting diagnosed with breast cancer. I'm not waiting. I ain't waiting till that long, right? It just is what it is, right? So like it was fortunately the 40-year-old or the organization that argued for 40 years of age for breast cancer screening won, right? And again, obviously because I'm a physician, but I take care of a lot of Black patients. Reason why that's important for me is because if there's some family history or something, typically, especially with prostate cancer, breast cancer, prostate cancer, colon cancer for sure, we actually will screen Black patients earlier based on the general population because we get hit with more significance. So imagine if I said 50 years old was the normal age. And if you're a Black patient, now I'm starting at 45, right? But like, if typically the normal age would have been 40 years old, I could have started my Black patient screening at 35 years old, right? So it is one of the things that unfortunately, Mega Woman said it is sad how insurance beats life preventative. Oh yeah, 100%, right? It's the reason why a lot of doctors be hating not medicine but just the business aspect of it because of these people who are able to make these decisions on behalf of the doctors and patients, right? Like, I mean, y'all living, unless you're living under a rock. Right now, we're dealing with a lot of, let's say, governmental like pressures, right, to tell doctors and patients how they should be operating, especially my women, right? Like, so we're dealing with that right now as we speak. I'm in Florida. So you can kind of understand that if a government can be like, no, you can't do this procedure on this woman, even regardless of the circumstances, because we say so, right? You can't do that. You can see where problems arise from that standpoint there. So definitely, one of these things where we just kind of have to battle, right? It's just definitely one of those things we have to battle when we're, dealing with insurance companies. But of course, we always do it on behalf of the patients. And because we do it on behalf of the patients, we typically will win at the end, right? So, all right, let me see more. All right, so I'm about to get out of here, right? Again, just information about breast cancer awareness. Topanga has breast cancer. She caught it early. She's in the process of kind of getting, treatment options now. She hasn't really kind of talked about what those treatment options will be. Obviously, I'm gonna keep an eye on it because I'm gonna keep an eye on it from that standpoint there. So y'all be blessed. For anyone who did not catch the live, we will post this on our YouTube channel. Links in said bio. And if you're a podcast listener, right, I typically take this audio and put it on the podcast as well. So it'll be on the podcast at least by Thursday? By Saturday for sure. So y'all be blessed. Y'all have a great day. Stay safe, y'all.